Today I'm listing the top 5 most difficult procedures I've ever had to encounter as a general dentist and how I personally manage them or literally just refer them out because they're so freaking complicated. If you thought dental school prepares you for everything, you are very, very wrong. Whether you're in dental school or you're just starting out, I'm sure you've heard of these procedures, but maybe you didn't think these procedures were as difficult as I think they are. And you're definitely gonna be surprised with number 1, so you don't wanna miss it. Let's go. All right, number 5, dental implants. Ah, yes, the golden ticket that everybody hypes up. Just place dental implants, you'll be rich. Sounds familiar, right? Pretty much every dental student in the entire country thinks that this is the way to Ferraris and partying on yachts with hot guys and girls. Well, here's the truth. They're not as scary as you may think they are, but those first few that you will do are absolutely terrifying. Like, think about it. You're drilling into people's bones with super critical anatomy, nerves, sinuses up top, nerves down below. All your angulations just have to be perfect. Yeah, you remember angle ranking in the DAT? Yeah, I kind of realized it's pretty important here. You mess up a dental implant and we're talking about some serious complications. Even something simple like a number 12 dental implant placement can go very wrong. If you just so happen to forget that the canine has a distal deflection in the root and you went straight normally as you would for most other teeth, you would hit the canine root and then you'd be forced to extract the canine. How about a number 19 immediate, going a couple millimeters too far and now you're into somebody's nerve and you can cause permanent paralysis of somebody's face. Yeah, I know, terrifying. But here's the thing, implants are pretty systematic. Once you nail down the planning, understanding how to look on the CBCT, feeling bone densities, you'll be able to better predict what torque you'll hit, where you want the implants to go. Everything becomes much smoother. But don't get me wrong, the first time you pick up an implant drill and you start placing implants, you'll be questioning every little decision you make. But after a few hundred implants, it's just another day in the office. Number 4, class 2 fillings. It sounds simple, right? Not for me, and maybe not for you either. Like, these fillings humble me all the time. I get it. Okay, fillings. Woo. For me, they're just so technique sensitive. Like, we've all been there. You're doing a DO on somebody's 14 and the patient's tongue is doing the Macarena the whole time and literally cranking your neck sideways just to try to get a glimpse of a margin and you really are not even seeing what's going on. Oh my God, the pressure there is so much. Doing class 2 fillings, so many things can go wrong too. Your margins may be off, the contact isn't right. It's the most common thing we do as general dentists, but I think it's one of the most difficult things we do too. Come on, even that ancient Tafelmar that we use, I never like using that thing. It's so difficult to use for me. How about rubber dams? Sounds great in theory, right? But it's not exactly practical for every single filling we do. Moisture control is an absolute nightmare for fillings. Like, yeah, rubber dams sounds cool in theory. Do we use it for every single filling? Not really. And then how about you taking your dedicated time to just sculpt in beautiful occlusal anatomy, and instead of a nice applause, you just get the patient saying, yeah, it feels really high. It feels like I'm biting on a mountain. Flatten that anatomy. Yeah, as general dentists, class 2 fillings are something we do most often, but I think it's also one of the hardest procedures we do too. All right, coming in at number 3, root canals. On paper, sounds simple, sure. Clean shape fill. But in reality, it's like a dentist version of the Rubik's Cube in the dark, because that's what endodontics is. It's like plumbing. It's like you're doing everything invisible. Everything is in the dark, all off of feel. It's so hard to even teach endodontics. You can't explain feelings that easily. Oh yeah, feels tight. Yeah. Ooh, you feel that curve? Yeah, it's curving down there. Oh, no. Everybody loves anterior endo. Okay, that's straightforward, super simple, cool. But what about those premolars with the crazy anatomy? Molars with 4 canals? Sometimes they're tiny, sometimes they're curved, calcified. Bruh, shoot me now. You can miss one, over-instrument one, block yourself out of the other canal, ledge. Endo can be a recipe for failure, which makes it, for me, one of the most hardest procedures. It's not just about skill. It's also about finesse. It's about navigating tight, microscopic spaces and also praying your apex locator doesn't betray you, because I feel like it betrays me all the time. But then again, I make sure to dry the canals and make sure you use the proper file, recheck the working length, also take x-rays to confirm. But come on, that all sounds so stressful. And for me with endo, every tooth is a new challenge, and I really don't refer out too much endo because I truly love it. And I actually want to get better at endo. But after doing enough endo, I really really appreciate what an endodontist can actually do. Because here's the kicker is that when you master endo and you get really good at it, there's a very special feeling of being able to revive a tooth that most people will just pull out. Number 2 on the list is wisdom tooth extraction. Now, if you ever extracted an impacted wisdom tooth, you definitely realize that those dentists earn their stripes. It's not just about tooth extraction. It's like a full-blown facial surgery. You're making flaps, cutting into people's gums, drilling away at the bones, avoiding the nerves. If you've ever been there, you try to put an elevator on its wisdom tooth to take it out. That thing is stuck like it's in a slab of sheetrock. You try putting the elevator in, twist a little bit, and the patient's like, whoa, no. Yeah, your heart will be pounding like you're on a first date with a baddie. You see, wisdom teeth are super unpredictable. One day you're doing a wisdom tooth extraction on a younger patient, maybe at the age of 19, 20, 21, Pell Gregory 1A, 1B, and then the next thing you know, you're wrestling a tooth that makes you question why you ever wanted to become a dentist. But truly, the only way to become better at wisdom tooth is by taking CE and really investing in your surgical skills. I took a wisdom tooth course in Guatemala. It was about $7,000, but it was live patient, and I got to expand my surgical skill set. For me, wisdom teeth are my favorite procedure in dentistry, so for that reason, I invested in it and tried to become better every single day with it. Like, there's just something so exciting about just digging a tooth out of pure bone. When your sections hit perfectly and the tooth breaks right where you need it to, and it comes out piece by piece, chef's kiss. Now, I get a lot of questions and DMs on Instagram about how to get into dental implants and place as many implants as I've placed already this early in my career. If you've seen my recent YouTube video, I've placed 1,200 dental implants in 2024 in my second year out of school. But my advice to everybody trying to get into implants is to learn wisdom teeth. If you don't believe me, check out my IG. There's more confirmation for you. But once you learn wisdom tooth extraction and master the basics of oral surgery, dental implants are not that serious and everything becomes very easy. All right, now number 1 on the list. You may be shocked to hear this from me, but honestly, I think the hardest procedures in dentistry are pediatric fillings. Yeah, you heard that right. Literally imagine trying to prep a tooth on a moving target. Your patient just juking you around, kicking, screaming, yelling, fighting you the whole way through. Like, at that point, you're not a dentist anymore. You have turned into Mickey Mouse and you are literally trying to mentally sedate a small animal. Sure, their teeth may be tiny and you think an extraction on a kid is easy, but for me, I think the hardest part is the patient management. I personally have never done anything harder than doing dentistry on an uncooperative child. You're under a time setting. The kid's attention span is literally the span of a TikTok video. You have to act quickly. You have to move like a ninja. They can't see a needle. You can't say the wrong thing. You can't look at them the wrong way. You gotta be very careful in the way you explain things or talk to the parent. For me, it's mentally exhausting. When you finally win over a kid, they connect with you and they allow you to do the treatment that you need to get done, there really isn't a better feeling like that. No Diddy. And you know, I love working with kids because it allows me to become a kid again and have fun and be playful. But I definitely don't do much pediatrics in my day-to-day life as a dentist. My office really isn't built for it, and sometimes it's just too frustrating for me to handle. So there you have it, my top 5 most difficult procedures in dentistry in my own opinion. You know, each one has taught me something valuable about perseverance, patience, and even bribing kids with Spider-Man stickers. But if you're a dental student or a new grad dentist, my advice is pretty simple. It's just every challenge is just another step in becoming a better version of you. You know, it may sound overwhelming at first, and everybody has gone through the same burdens. Trust me, practice makes perfect. If you've got your own horror stories, like, share it in the comments down below. Reach out and engage with me. Let me know what you think. Hit that thumbs up on the bottom, subscribe, share this in your group chats. But until then, Dr. Ron is signing off.